Good afternoon, ladies and gentlemen, and welcome to the news behind the news with Rav Kantav on Mix 94.7 FM. I hope that you guys have been having a good day so far. This afternoon, I have here with me Mr. Cedrick Ortega. Many of you may be aware of who he is or have seen some of his posts on social media, etc., particularly as it relates to conversations on the vaccine and this whole pandemic. And this is one area that I haven't necessarily gone into on the program. So I'm glad that this is a start. And so good afternoon to you, sir, and thank you for joining us.
Good afternoon, Ralph. Good afternoon, viewers and listeners. Thank you for the opportunity to be in the show. I just listened to your show, and I really love the way you conduct your interviews, and I'm glad to have this opportunity myself to be with you in this program.
Good. I really appreciate that as well. So one of the things I'm curious about is what was the spark that led you to go into the field of science?
Science. As a kid, I always wanted to know. That was just the nature of my person, curiosity. And one of the things that used to fascinate me the most was the chemicals under the kitchen sink. Mm-hmm. I would always look at them, turn them around, try to figure out what was in them. And those words were impossible to pronounce. You would see the abbreviation with the numbers, methylane and methyl 1 and ethanol and those type of things. And having no clue what they meant, I always wanted to go and understand what those chemicals were. So from small, I was really into chemicals and how they would react and trying to understand what those words meant. That was the real impetus behind going in that direction. And of course, in high school, chemistry and biology, they spoke to me. The language of chemistry just made sense. Yeah, I went to MPC, okay. Did my MAVO in MPC, then I did my HAVO in Curacao before traveling to the Netherlands. And I stayed with the exacte paquette, the sciences. That was always just second nature.
Okay, gotcha.
Yeah.
Gotcha. Okay. So, like many people, I'm aware that, when you finish your studies, you came back home, and many of us, you want to flip this island on its head and do all sorts of stuff.
I was a little bit more conscious coming back. I was one of those that say, when I come back, I'm going to introduce people by my grandmother. Myself by my grandmother. I Viva grandson. I Lorraine grandson. I Shaboy. I Lorraine's son. Because who am I? You irrelevant. So I understood my society. So it is about linking myself to my elders and to those around me who have been established in a community and have that credibility. It facilitates dialogue because they know your mother, they know your father. It becomes much easier to enter that conversation. So I was very conscious of not stepping beside my shoes or getting pulled on. You in Holland. I conscious of those things. I was very strategic in how I placed and moved myself, even within the working environment. You come fresh, seeing a lot of things that could change. But you don't start screaming change. Mm-hmm. You first get fully integrated in how things are, and from that perspective, you look for the right opportunity to make suggestions here and there, almost to the point that the other person thinks that was their great idea, and like that you build and you gain influence and you gain people's trust in your ability to facilitate things. And like in the lab when I came back, we had a young group of us, myself, Jasmine, and Juliana. We fully automated the lab. We turned the whole process around. We went from 14-hour days to 5-hour days, 4-hour days, where we were able to expand the amount of patients that we were dealing with and stuff like that. But by making innovative steps, but not by coming in and throwing fists. You do it over a process, and once people see things going, it's no more about the person that doing it, but it's about the idea itself and how we could take it forward. But you have to have a certain amount of tact and a certain amount of humbleness, knowing and understanding your society. It's just part of coming
Definitely.
back home.
I'm glad you share that because that makes a lot of sense. Although sometimes some persons are not fortunate in that sense to accomplish such.
It's a two-way street.
Mainly with the barrier. Because, for example, not everyone could say I'm such and such son. It's just like, who's your parent? You know?
Yeah. But again, it's a nuanced approach. You got to understand there are certain barriers in your society that you have to overcome if you want to make a difference here. So, like my generation now, I don't care who your mother or your father is. I watch how you perform, the individual. Now, in dialogue, I could maybe link you to your parents and go, I didn't know that was your father. But I recognize the individual based on their merits. So that's where a shift now might come in my generation or how we do things.
Yep.
But you got to understand the generation before you
it was totally different.
had a certain amount of value in knowing who your parents are. Like, which party you going? Who the mother? Where the father? Where house that is? And based on their knowledge or interaction with the parents, you were able to go or not. So you understand that in my generation. So you don't come back here and say, "Hi, Cedrick. Hi, Lorraine. Bye. I be your grandson." That's a much more easier way. But again, there are other nuanced elements somebody could use in order to facilitate that reintegration process. Because my generation then, I went and I stayed a pretty long time away, 4 years, 4-year stretches before coming home. So I needed to reintegrate when I came.
Because you come back unknown. And that's understandable. Yeah, because I think what helps. Conversation kind of turned different but I mean that's cool though. We'll bring it back later because I think what it helps is in young persons being active from high school days, building some sort of awareness, and because we have quite a bit of active youth groups, and I think it's important for those children to participate for their personal development, but also because then they contribute to the island and then you make a name for yourself. I'm always thankful for like Teen Times, where I'm now professionally in media, but then I was an amateur in a sense, since high school. But through that, you build your name, And
a couple of you did that beautiful. Kevin is another.
Super, exactly.
Super, and Mr. Dick Andrew too. From youth days, building and had a name in the community. Now my path was a little different. Most of my accomplishments are scholastic, like sports-wise, and so outside of St. Martin. Now that comes because I was very sheltered. How did he leave me? Go nowhere, do nothing. Yeah. So at the moment I got off of St. Martin,
that's when you burst.
I did all Muay Thai, and so my name is known in Curacao in Europe. But St. Martin, nobody really knows me as a kickboxer or a high level basketball player. I played semi-pro in Holland, just under the pro. So Nivelle. What do you say? A-class niveau basketball. I play baskall now. But in St. Martin, nobody knows me as
the baller. And he bad, man. He was bad back in the day. I got you.
Yeah.
Well, that's how it is. So even in terms of, coming back then, as you just shared, working in the lab, I know that you played a pivotal, instrumental role in, building policy when it comes to public health.
So can you share details on that? After my first initial 3 years in the lab, an opportunity came to go and work for public health at that time. The Hygiene and Veterinary Department were tasked with the establishment of the Drinking Water Ordinance, and coming from the lab background, I saw that as a challenge and I took it on, and indeed it was a challenge. I didn't expect that the process from start to finish would take over 12 years. But again, it was different facets of the law that, things missing on the island, and we had to get them implemented. So SLS, our National Local Laboratory, was established by my person in order to execute the drinking water ordinance. They needed an environmental lab. So in that process of transitioning the lab, I was the director there. I wrote the policy outline for the lab itself. The structure of the SLS and stuff like that. Preparing the legislation, I had to amend the generic piece of legislation with the drinking water ordinance. And you hear me talking about amending legislation. Mind you, I come out of the technical, analytical environment. So in that transition too, again, it was a process of learning how to write policies adequately, understanding law, how to amend laws and stuff like that. So it was a growth process. And in the end, we have SLS now for quite some time. Mm-hmm. We have a drinking water ordinance by which the drinking water producers and distributor, mainly GVE, has to comply.
Follow, yeah.
Gotcha. So we have good water quality in St. Martin, folks.
We definitely do. We definitely do. Not just even regionally, but
yeah. We are
by far.
We are number 3 in the international competition for water quality. St. Martin has been within the top 3 for the last 20-25 years.
That I even know. But I just knew our water was good because
international taste test.
For example, thinking back on Florida. I remember drinking water in Russia. I was like, "Jeez, it's like you're drinking metal."
Wow, in some places, like Puerto Rico.
Yeah, terrible.
So where that's concerned, we can open the tap here and drink straight from the tap. You pipe outside. The water is clean and fresh, but of course, marketing and commercializing of bottling water, it's the marketing game where we create the illusion without saying it, as if the water that comes out of the tap is less than it should be, whereas that is not the case.
But further filtering that water, I mean,
no.
Would you say it's a...
No, a waste of time. If you put in a filter, it's pretty much a taste filter. The water is clean. I know some people even have reverse osmosis setups in their homes. And again, this is a lack of understanding science. The water is reverse osmosis prepared. So what are you reversing out of it? What you're taking out to put back in? It's extra filtration. Sometimes, especially, it doesn't happen often anymore. When GB was upgrading their pipes, removing the old metal pipes and putting the plastic, you would have in some areas that the water would get brown. Mm-hmm. That was for a short instance, gone again. Pretty much, even the solid stuff, the solid amounts in the water is measured and has to meet a certain norm. So you can filter the water, give yourself a peace of mind, but it doesn't
overall
improve the quality of the water.
Once you've had water from elsewhere, we have great water. Yeah, you know the difference. Yeah. So one of the things I'm curious about too is, what are some of those public health concerns that we overlook that we could, really tackle?
Setting up the EVSR, the inspectorate, I was one of the inspectors. I'm chosen or selected to go over to EVSR and the transfer of responsibilities and the setting up of the different entities. So based on having worked in the public health before, I established a food safety program as part of a team. So food safety became a unit within the inspectorate, which is responsible for the execution of inspections with regard to food safety, personal hygiene, etc. And I developed the environmental lab, the environmental department, which was to deal with our number one problem, which is sewage on our oil. Mm-hmm. We are fortunate that there's a separation between our water source and wastewater. Mm-hmm. See, wastewater usually goes into the ground, and by that means it goes back into the environment. Where our drinking water source is seawater reverse osmosis. Heavy seawater is salinated, of course, so it kills microorganisms fast. Mm-hmm. There's no direct link between our wastewater and the seawater. So the separation of those two processes is why we have not encountered more more public health and environmental issues with regards to sewage water. But Dutch Quarter, you see how the community is coming out now because infrastructure is being laid. There's some sewage running in the drainage system, but it's not going to an adequate wastewater treatment plant. And a lot of the homes, how they are built in St. Martin, makes it difficult to connect to a grid. You know, so there are some bottlenecks and some challenges there still. Certain decisions based on finance and so were made. Again, let me just back up. One of my interns was done in the third largest sewage plant in Europe, Terapa Canal, Avibay. Because going to study, keeping St. Martin in mind, I did 2 interns, which gave me the biggest possibility coming home. I did an environmental laboratory science, which dealt with wastewater treatment, very basic knowing the nitrates you release into the environment, how to control that for water quality. And I did medical as part of the research team for oncology. I did the staining for the COX-2 enzyme in the gut. Why the 2 extremes? To give me the broadest spectrum coming back home to be able to apply myself.
Gotcha.
So when you hear me talking about certain things, it's like, what? Yeah, I do have some knowledge in these things. One of the situations you see, for example, Dutch Quarter, is putting sewage under pressure. Putting sewage under pressure causes to get heat. It heats up, and it's sewage, it's bacteria. You add heat to it, the bacteria grows, and you get the increased H2 H2S smell. The H2 that sulfur rotten egg smell is produced by putting sewage under pressure. With our hillside environments, what would be more natural is to no pumps, flow from up, come down. So you would put your wastewater treatments in your valleys, and look at it.
Gotcha.
That would be Coal Bay for that whole basin. The one in Cul-de-sac is proper for that basin, and then Dutch Quarter, Belvedere area for that basin.
Because that's also a valley.
Yes.
Yeah.
So now you eliminate the pumping. Everything use natural gravity downhill to sewage treatment plants. But again, now we're talking 3 separate treatment plants.
Yeah.
They don't all have to be the size of the treatment plant at 80 Ellis Road.
Yeah.
But that's a different a framework of thinking how to manage these situations, which would make them easier to control. Putting sewage with pumps and a lot of electricity and sending it up and over, that makes the process hard. You use natural gravity, bring things downhill, put it in the center, and everything would flow much easier to these treatment plants. Financing and logistics always play a problem, but that up to today is our biggest environmental risk that can potentially have public health issues going along with it, communicable diseases.
Yeah, because we did make some sort of progress. I guess that's homework in terms of figuring out where that stands as far as the sewage project with the EU funding.
Yeah, they put in lines and stuff like that. You see on the main road, LB Scott Road, the Dutch Quarter situation. It was stopped. Funding was an issue, etc. So the steps being taken. They have the expertise and they have the logistics on how they're doing things, and I think putting in the piping on for the main connections is essential, and that needs to be done first. It's much harder process figuring out how to get the homes connected, but if you have the homes connected without them having the main line there, then you have a bigger problem.
Yeah, so it's just going everywhere.
The way they're working is good. But then again, in my observations, if we're not talking about 3 independent sites, then we're missing the mark a little bit, because now you can't expect to pump all that wastewater up and over hills
and then bring it
there.
Centralize it.
If you're going to put in a wastewater treatment, for it to be cost effective and do what everybody has to be on the network. So you can't say you put in some, but that area no, because then you're creating and maintaining the same environmental issues and then public health risk in that area. So my humble opinion would be be looking at least 3 sewage plants and 2 additional smaller units in Dutch Quarter and in Coal Bay, probably a big one also with all the industry that is there. I know for a fact that a lot of establishments, larger establishments, get a hindrance permit to establish a wastewater treatment plant. Yeah,
for their own,
and then they process the water. It meets a certain effluent quality that could be extracted into the natural environment. Who does the follow-up? How is the maintenance handled? Who tests the water quality? Now, this was all the stuff that was doing in my environmental hygiene department, but somehow Dr. Bess found it not necessary. The department don't exist no more. But so now these entities are pumping sewage,
but without control,
without having to monitor their quality of the effluent, without having to report to an entity on the quality of the effluent. And so we see like the Nature Foundation and does testing and stuff like that. All these need to come together.
Yeah.
And the legislation is there, because I prepared also the effluent norm, so the quality that the effluent needs to meet to be able to be extracted, it is there. It's a matter of implementing these things. We have SLS, which as an environmental lab is outfitted with the necessary resources to test uppervlockte water, like after water has been treated, so the effluent. We made sure that all these instruments
put in place
were in place. But again, you need departments and heads of departments that understand the importance of these things and actually go after them. And a lot of the time, it is to get the wheel turning. So you have to have people who has a understanding of the importance and a passion to see these things come into fruition. As trained in laboratory science, quality control is the root of my being. So I want to know. You're doing it yet, but what's the quality? So that is the driving force that you would need for somebody to actually get these things under control.
I like that you said that, because the bottom line too is the fact that it affects the public. Yeah. As long as it affects the public, there has to be that level of control. Yeah. Because there's several things that come to mind. One of them being maybe ironic that you mention another plant in Dutch Quarter, because the one that was proposed for the Kobe area was with the EU funding for both sides. It was the first ever type of project put together. In Dutch Quarter, the one there could be placed again right at the border between both sides. So I think that is how us as one island could definitely work together as one. But another thing too, this whole concept idea that we speak of in terms of nation building, because it seems like sometimes you don't necessarily get certain parts or cogs that go into the proper functioning society. We this is like we look at the bigger picture, but then the fine tuning is not there, because the main thing that stood out to me with what you said is personnel, and also showing to our youth, as we started talking about the youth and so forth, the avenues of creating livelihood, contributing to the society and so forth.
Yeah, I mean, there is so much. I mean, we have so much that is being done on the island, and our youth do not know.
Yeah.
But like excursion to a wastewater treatment plant, there's a couple of nice ones on the island, and then you can be knowledgeable, and these are the expertise. These are the areas of study. Yeah. This is what you could do.
Expand their minds.
Expand their mind in different environments instead of what we always see. So you would see somebody in a short pants and some dirty slippers going up on a sewage plant and dipping a bottle and taking, AKA excrement water, And without understanding the level of science and the level of education required to do that job, and how much that partner is getting paid to actually stand up on that.
Yeah.
You know, when you put those things into account, and these are the services that ain't going out of style.
No, they.
You know what
no.
I mean? Sewage, they gonna be there as long as humans are alive. We gonna have waste.
Yeah.
So you know, it's always a necessity, but more young people need to get exposed to these understanding.
Yeah, I find like with us and we need to break that limit. I it's I guess a personal venting, but hating not liking that we just limit our people to waitresses and cooks and just serving the hospitality sector. It's like we can be far more than that.
I have fundamental, deep-rooted issues with our education system on a whole, for various reasons. I do not feel that our system. The last 2 years proved me right. The last 2 years showed me that our education system has failed this society. And I'm not talking about the educators. I'm talking about the system. Mm-hmm. I love my teachers. Let me tell you that. I'm not going to ever speak ill about our educators.
Educators, yeah.
But a system, education that doesn't have at its root how to think, not what to think, how to think, we ain't going nowhere. We got people that know how to reproduce information, and we have a society that functions on belief rather than knowledge. Far too often I ask one or two questions and the I don't know or me know. But that's what they always say. Who's the they? Who are these? Who are these they? How do you go through life just believing something your whole life? Our education system don't challenge the thought process. I am sorry, to each his own. Belief and knowledge do not exist in the same environment. These religion-based schools take away our children's capacity to know. You know, when I got scared when my daughter in third Harvard came home and asked me if Adam and Eve was real. In the third Harvard? What? Huh? Think about it. You're doing biology. Go through that process. Can that be? But at 15, you don't know the difference between what you believe and what is actually fact. What in our education system doesn't teach our children how to discern? What process am I going to go through to distinguish what's imagination and what's reality? How do you go? That's a daily exercise, almost an hourly exercise. How do we apply that? And when we take that away from our children, you see that they're limited in seeing what they see. The ladies and gentlemen come out of the banks, suit and tie, right? Mm-hmm. Perfect, beautiful nails and stuff like that. On the other side, you see guys them coming from the casino. This is what is visible. So when what you've seen is so limited, your options become limited because the exposure to more isn't there.
It's like in Lion King, the reference when Simba I'm mixing up the name Mufasa, Simba. Anyhow, when Mufasa told Simba, everything you see here and beyond.
And beyond.
Yeah.
And beyond is so important, to go into those little niches and the nuanced areas.
Definitely.
We need to expose our children to a lot more.
Definitely. So with that, we're going to take a quick break and we'll be right back. Good afternoon, everyone, and welcome back to the News Behind the News with Rav Kintav. And today, I'm joined with Cedrick Ortega. Conversation definitely didn't go as scripted, let's say. Most of the questions that I actually initially have weren't asked, but that's no problem, man. For me, as long as we talk about information, I think, and facts, that matters. But I'd definitely like to go into COVID and the pandemic.
COVID-19, pandemic.
Because I think there are a lot of misconceptions, whether with terminology and even practices that we have. which would help. And my first question for you is kind of looking back at the outbreak of it. As far as I remember, during when the lockdown just came, and when we were about to approach lockdown, you spoke a lot about a suppression plan. For me, I didn't understand what you meant, honestly. But could you go in detail in terms of what that meant and what would it have done for St. Martin?
The onset of let's go back a little bit.
Okay.
An observation. This is what I do. This is my background. I'm a biochemical engineer. I worked in public health. I dealt with pandemics before the dengue outbreak. I was the director of the lab at the time where we was doing target analysis and identifying hotspots because dengue is mosquito bound. So you want to know the area in which so different procedure. We had the SARS and the MERS outbreak. That time, Dr. Airsel was the chief epidemiologist at Public Health. There was a more cooperative structure with EZ from Curacao. So the plan of action was created. We were all trained, did field epidemiological training, how to identify and stuff like that. So we get the background training and how to do field work. And my own understanding, based on my background, viruses, immunology, etc. You put the package together and you have a big understanding of how this thing works. So I looking at this virus and they calling it the Chinese flu. The Chinese flu, and we joking, and the corona, we drink corona, and I too engage in it. And then I'm seeing this, okay, it is coming. Then I started to raise the question locally, do we have quarantine and isolation facilities? The reason I raise those concerns is because I know that we didn't. As a public health inspector, having gotten my ship sanitization course, one of the requirements to execute ship sanitization certification is that your island or your port has to have the ability to quarantine, triage, and isolate individuals. So right now, as it stands, there are individuals from our neighboring islands, because they fall under the Dutch legislation. They, yes, have the right to certify ships based on hygiene and ship sanitization. Knowing that we couldn't do it, I started to raise a question. Why? You want to keep a virus out at your border. So your process of control and measures start at your point of entry. It's not here. We know it's not here. We need to seal off our points of entry, and there we need to have adequate testing. When you test at a high level, what you're doing is going in, taking out. So I'm testing 500 people, and I take out the 200 that are infected, and I literally take them out. So I quarantine you. I had a problem with the word self in front of quarantine and or isolation. These are imposed measures. I could stay away, but I'm not quarantined.
Gotcha.
I can isolate myself, but I'm not in isolation. Those are measures that we introduce and we put on. So a suppression plan at the point that, okay, the virus is here, and a suppression plan actually means we are going to target the virus, suppress. We're going to take you out, military style. So what you have is we are actively going look for the virus. And that was when I was so adamant about know your status. One of the first things I did when I understood the virus is coming, what kind of diagnostics exist? That was very early in the phase. I contacted a manufacturer in California. At that point in time, they were shipping to the Far East. They were shipping to China, to Taiwan, because Taiwan implemented a suppression plan. Far range testing, test, isolate, extract, isolate. Leave your society open and deal with the cases. We were fortunate, I thinking, it's off island. It has to come. Shut our borders down and we suppress. We take out those individuals coming in, we quarantine and isolate, and that would have kept the numbers down. Suppression is where we going to look for the cases. I'm not waiting till symptoms develop and then the consequent, the tracing and tracking. No, I am actively going to look for you. If I find you, who is in your direct environment, now we monitor these, we test them, negative, we leave them go. First one, pus, we take them. When you are in quarantine earlier, a treatment can be applied earlier. Your symptoms better monitor, early treatment, and don't wait till you get extremely sick to then start treatment. This was the suppression plan. Suppression meant I was going to introduce the community councils, all the big, the voices in your community. They was going to come and be part of the script. So thereby, we know them. We would have had them in. This is the message. This is what's going on. You and your community. Community councils would have been charged with monitoring those people that need to be isolated in their environment. So now you know that they are complying. Number two, they know that there's a community outreach, that they could get the resources necessary for them. A proper budget would have been put in place to facilitate groceries, etc. Mind you, if I'm the breadwinner, out for a week at 0 hours contract, just with because I'm quarantined, because I was in contact, it is hard for me to swallow that, knowing I am the breadwinner. That week I home, nobody compensated me. So my suppression plan dealt with all of these areas. I had it vetted by Roger Lutz, who's ex-military Navy pilot in biological warfare. So this is how you go in, target, and deal with the pandemic. Good.
Gotcha.
I understood at the same time this is the world that I live in. So I knew about the Wuhan simulations taking place. And for me was, boy, this going to cause issues, because I know Bill Gates doing the Wuhan simulation, doing simulation, viral simulation, how they spread, how fast they would spread, what type of viruses. These are done every so often in epidemiological models, okay? So that's why the word social distancing and these things, they ain't novel words. They are words being used in these kind of studies and that kind of setting.
Gotcha.
So my head was already geared on how we are going to manage the pandemic. What I saw is that we went into disaster mode thinking, as if we're dealing with a hurricane, where we want to hoard people, where we want limited hours, we want people off the streets. In a hurricane setting, you put people together. In a virus setting, you want to spread them out. You want people as far away from each other as possible. I was staying 24-hour society. We're going to be open 24 hours, folks. You can even have an economic benefit. Because now, having my place open for 24 hours, I want to reduce the exposure time of my staff. So instead of 8-hour work days, you're going to work 4 hours. You open 24 hours, that opens space to bring in more people. If I have a volume of 200 people in 8 hours, what is that volume spread out now out over 24 hours? The less people, less contact. So the whole mindset in how the pandemic was first approached with, again, coming out of the environment, I wasn't panicking. Okay, no problem. We can just deal with it. But I understand when you most people never even knew that a 1914 pandemic. Most people don't understand what smallpox was and what that did. So I can understand to some extent the panic that ensued and the decisions that were taken. But on the other side, I was screaming from the top of my lungs, I should have listened to me. You know what I mean? Today, what John Hopkins say? Lockdown, shutdown, did what?
Didn't work. And it was economically damaging.
An airborne virus from moving. I told everyone 6 degrees of separation. You know who I got COVID? sitting down home. I don't go to clubs for years. Out to eat is, it's with one person, usually with my partner. I'm not in those type of settings anyway. So I don't know whether we got 11 o'clock curfew or 9 o'clock curfew. It makes no difference to me. I'm home. A friend of the family came over, just outside on the porch, with my partner. They just talking. We didn't even do the regular hug up thing. They just was in the environment. I get dealt up. So now, when I hear all the arguments and all the reasoning behind it, it's human nature too. We want to blame somebody. You remember when it was too much motorbikes on the street?
Yeah.
The scooters became...
I think a classic example was 9/11. Yeah, I think that's probably the best example.
So you see that the panic ensued.
And the fear.
The fear,
yeah.
Mind you, I was scared. I have lupus, and I understood how high risk I was.
Your person, yeah.
Understanding, I can't see this thing. It's in a fella you could stand up and prepare yourself or see it coming, run, duck, and hide. You just didn't know. And that's why before the advent of the vaccine, I could understand the trepidation that existed, although from a policy perspective, I would have done things a lot different. I would have been more forceful on the border. I would have seek opportunity or two to commandeer one or two resorts, train their staff in what is going to be the function for the next 3-4 months.
Yeah.
Finance these institutions properly and outfit them like that. A medical team. I would have put together a medical team, 2 doctors, 6-7 nurses who are going to focus on dealing with these cases. That would have been the initial phase of how I would have dealt with it, a more suppression action than a more mitigation action. I would have chosen again my Taiwan model. An open society, a lot of testing, government, I'm going to use the word imposed, quarantine, and isolation. But understand what that means. You see, like I say, a hotel setting, because you're not a prisoner. So you get a room. Mm-hmm. If you're clear after the week, you go. Mm-hmm. If you need further medical attention, we have triage. So you're not going to use your medical center. So that stays open to deal with normal cases. So these were some of the steps that I would have done differently, and that's not in hindsight. I have a suppression plan saying it, so it's not in hindsight. I have the documentation.
Well, I guess at this point it's more like you're living in
analysis.
So that for next time.
So next time now, I am expecting,
because we definitely do expect.
But because what I'm going to say on the other side of it is, you have seen the growth though in how we handle the pandemic.
Correct.
There has been a change. There has been a more science-driven, data-driven type of policies that the minister has employed. I'm going to say clearly, I am part of the advisory team of the minister, but if this wasn't the minister's fundamental way of thinking and reasoning, we're going to do a database, science-based approach. Our policies are going to be geared toward the data. Nothing I was saying would have made any sense anyway. So it's a collective team that decided to go down this direction.
Okay. I'm glad you shared that, and we're going to get into as much as we can, given the time. One of my questions is, there has definitely been a debate about the nightlife, Where do you stand on that based on the research you've done?
I do not agree
that it should continue. That it impacts.
The spread of the virus is going to happen, right? But now look at 8 hours of regular business, whereby tens of thousands of people are interacting in that regular 8 hours with the different businesses, regardless of the measures that exist. They are there to reduce the risk, but the risk still remains, compared to a select group a select demographic in restricted areas where there's a limited amount of people can access them. Look at the data. No shutdown reduced the cases. The cases follow a natural cycle. If you put those graphs on top of each other, right, it is the virus that dictates the graph. The severity, the transmissibility, those are the factors that play a role in how that graph plays out. Once humans become aware of a virus in the environment, our behavior changes. Automatically, there's a reduction in how we go out, how we interact, we prepare, we protect ourselves, we use sanitizers, etc. So we put a lot of environmental pressures on the virus, which reduce the spread. But if you look at the natural curve, it is the way that the virus is going to move. It's going to affect a lot of people dramatically. It takes time for the numbers to go down.
Which we're witnessing now.
What we're going to see, the last bit's going to go slow as she goes towards an endemic phase. So the data doesn't support that nightlife was the real driver behind the virus, and that is not the case. The virus is airborne. You can come into an environment a half an hour after, nobody in the environment, leave with COVID. You know what I mean? But when we create these stigmas, we're creating stigmas by selecting groups of people
to beat up on.
Then what you get is that how much people we see in numbers. We are on social media, but you don't see nobody say, hey, had COVID. It ain't so bad. Hey, I had COVID. It was rough. Hey, I documented my whole process.
Likewise,
I got COVID.
Because I think we need to. It shouldn't be a. For me, it shouldn't be a taboo. Because I think that with this time that I got it, it could be the third.
Yeah.
Because from the time before, so from since. Let me see. From since 2019, back when I was still in college, when I was working, I used to work in one of the restaurants on campus. At a time where a lot of my colleagues were out of work, and in the school itself, a lot of students were complaining about having the worst flu in their life until months later you recognize that we had COVID around us. And then I definitely remember in 2020. I don't know if at that time I was. Probably asymptomatic around, couldn't isolate in the sense of around multiple people with COVID, but only until this time around, early this year when I got it, then I felt the symptoms.
But again, we have to understand too that reinfections and infections going to happen.
Yeah.
The nuance is, and especially people like to put, but no, how come after you get chickenpox, you don't get no symptoms again? It's a blood-based virus versus a respiratory virus. The symptoms of the respiratory virus is what those in the hospital experience. That's when you get the disease. When you get those small, that's your immune system responding. The snuffy nose. What happens is, first thing your body does is produce excess mucus, right, to get it out. So it isolates, it traps. So actually, those little symptoms we experiencing after being exposed or after having been vaccinated are not symptoms per se.
I got you.
They are your body expelling the virus. Now, with a blood-based virus, what we expect to see is the pox. But we don't realize that little uncomfortable feeling we had for a day or two, or that headache you had that afternoon was really bad, and it gone. That's your infection taking place, and your body responding accordingly. So you don't see no physical lesions, so you assume that you don't get reinfected with chickenpox. But chickenpox right here. Measles right here. Ain't gone nowhere. Is that we either have a vaccine against it. A generation younger than mine have the MMR vaccine. My generation, we had a chickenpox, we had a rubella, we had a mumps, we had it all. Now, we don't see it in our society no more because of the vaccines. But it ain't gone nowhere. In the world, 7 to 8 million children die every year still.
Yeah, of like
from measles.
Measles and stuff.
Right?
Yeah.
We are fortunate that we don't see it in our community. That don't mean it is not there. So it's there infecting people. But the vaccines and our immunity prevent us from it expressing. But we get reinfected all the time.
So how soon do you see us?
We're done.
In terms of endemic phase.
We are since September last year. We're pretty much over with.
So this is the slope of.
So what you're gonna see is now the B2, the B3.1 variant coming out, the B6.7 variant. What this is science monitoring and tracking the mutations that happen with RNA based.
Are any expected to be detrimental or just
no?
Weaken over time?
The virus itself or the particular strain plays less of a role in our day-to-day lives now because of most of the people either having been exposed,
in fact, yeah,
natural immunity, been vaccinated, vaccine-induced immunity, or a combination of two, right? For example, I know the Omicron variant come past me by. I was just recently infected with Delta. So I have natural immunity and I have the vaccine. The spike protein prevents the either one of those variants from entering into the cells. And the fact that I got Delta means that I have the broad base difference in the immunoglobulins that are produced. So even if I run into B6, B12, my body's ability to respond appropriately is already there. So the severity of the virus itself at that point doesn't really make so much a difference. What can become an issue if this virus mutates to a point where we can even no longer consider it SARS-CoV-2 COVID-19. Then we are talking about the SARS-CoV-6 virus, and then that we'll be looking at a separate virus. You see,
gotcha.
this SARS-CoV-2 strain is our the fifth one now added to the colds, the common colds that we get. So we are exposed to 4 main coronaviruses already, which cause the so-called common cold, and its variants. So you could see the amount of times, but you always catch a cold. The amount of variants that exist. You're always exposed to something new or something different. We are now adding the 5th corona strain to it. If we have another zoonotic jump in maybe 2 or 3 years, or maybe 10 years, or maybe never, or hopefully never, we will see that, okay, this is a 6th corona. The word novel is going to be introduced again. You see that the novel part gone, right?
Correct.
After 2 years, it's not novel no more. We can't call it novel. So now if another completely total different 6th strain pops up of the main corona group, we might have to revisit all these processes and realize that we are now exposed to a new virus again, which is novel, we have no protection against, and then we introduce by means of vaccines, and we go through this whole exercise again. But in terms of this 5th corona variant, the SARS-CoV-2 variant, continue to mutate away. I'm good. We'll be good. But media is going to show you the new one will come out, and it's taken over, it's the dominant strain, and from the time Omicron
media,
came
also,
in,
a sense, mainstream media.
Omicron, when Omicron came in, I kept telling people the numbers are less relevant. It is proven to infect everybody. So if you had a society of 100% vaccinated, 100% of the people, and it's 100 people, you would have got Omicron. 100% of the people are infected. That means 100%, but 0 hospitalizations. And that's where we're seeing that we got the disease under control, how we look at the hospitalization. Unfortunately, locally, we see over the weekend we had 2 more deaths, unvaccinated individuals, not previously exposed. And taking into consideration getting naturally infected, it is a risk, right? 99% of the people are going to be okay, huh? But are you that 1%? And how you going to know if you fall into that 1%? Getting the vaccine and knowing that you're going to be exposed to this virus puts your mind at ease. You know, regardless, I ain't end up in the hospital, I'll be fine. So there's where the nuance comes in when we're looking at the numbers, and not focusing on what the hospitalizations are.
We got to end off here, but basically I think what I'll add to the point you made is probably what we could use more of, should have had from the beginning, is more analysis of the data, because it's pretty raw. So it leaves it up to various interpretations.
That's communication. And from the science side, I have to take a hit. We failed in properly communicating the data. You see, that whole confusion came about when Fauci said, but of course you could get infected, because we know that the virus vaccinating will stop infection. So, our methods of communicating based on our environment, we need to pay more attention in how we relay in information and not take for granted that people automatically understand these things.
Definitely. So with that, I would like to thank you so much. Again, there was so much more questions, but I look forward to having you back on the program.
My pleasure. And of course, I'll invite you to our program where we could continue the dialogue.
That's cool. That would be good.
Because cool. I think we both have the same kind of drive, is information, growth, understanding. I see that and I appreciate what you do very, very much. So thank you for having me in the program.
My pleasure. And to our listeners and viewers, definitely hope you enjoyed this engaging and informative conversation. Be sure to tune in again tomorrow. Take care.